But my thing is a charter school.
No, we don't.
Yeah, we don't need no plan. That's like we have so many other.
Good evening, everyone. It is 6:09, May 14th. My name is Marilyn Pena. I am the chairperson for the Health and Human Service Committee meeting, and welcome everyone. Call to order. Introductions, everyone. Run the table.
Hello, I'm Christine Licata, and I'm an arts consultant, and I live in Brook Avenue, Bronx.
Hi, my name is Stephanie Calzado. I am chair to the Young Adults Committee.
Good evening. My name is Joanne Tate. I'm with BNS Health. I'm a program manager for the Friends Clinic, mental health outpatient treatment and rehabilitative services.
Welcome.
My name is Portia Wilson, and I'm part of the committee.
I'm Anthony Jordan, District Manager for the board, and for FYI, Madam Chair, our board meeting is being live streamed on our YouTube channel.
Yes.
For those to be able to see. So we ask the presenters when they present, please stand up near the chair table so that we can be part of the live stream. You want to introduce the audience, Madam Chair? I don't know if anybody or you want to.
Anyone in the audience that want to introduce themselves?
Sure. My name is Melissa Carreño, and I'm the director over at Tres Puentes Community Health Center. Nice to meet everybody.
And I'm the Jeanette Melendez. I'm the Associate Vice President for Health Center Operations, and I also work with Melissa on the Urban Health Community Health Care Program.
And my name is Sharice Cash. I work with Portia Wilson at Fifth Neighborhood, and I'm a community health worker.
Thank you. All right, so we're gonna introduce a new business for the urban health plan. Tres Fuentes, Melissa, director.
Yeah. Hi, everybody.
Hello.
Good evening. So my name is Melissa. I am the director over at Tres Fuentes Community Health Center. We're located on 138th Street and 3rd Avenue, right on the corner, below the senior facility above us. And we've been there since 2020, providing care services to our patients, to the community of all ages. We are part of Urban Health Plan, right? So Urban Health Plan is all over the Bronx. We also are part of, we have a facility in Harlem, and we also have a facility in Queens. So I'm here today to let you know a little bit about ourselves and, to learn more about this committee, but to also build a relationship with this committee as well. I did share the flyer. It's right in front of you. It's the blue one. And on the bottom side, you'll see all the services that we provide to our patients and the community. We see adults, we see teens, adolescents, pediatrics. We also provide GYN, women's health. We also do telehealth visits for those who are interested in that. We also serve the LGBTQ community. We have a clinic called the Equality Clinic. We have one in Tres Puentes, but we also have one in Hunts Point with Bella Vista, and as well as the main site at 1065 Southern Boulevard. We also provide mental health and wellness to adults and children. One of our famous sites is the Vita Guidance we were talking about earlier. They also provide family mental health and wellness as well. We also do nutrition, WIG, social services, health education, and case management. Currently, as well, I didn't share this flyer, but I'm going to share it with you now, and I'll send it via email. We also provide health insurance enrollment to families, and also the migrant families are coming from all over the world. We also are seeing them currently at our clinic, and we're providing the service. So on Mondays and Tuesdays, we have health insurance enrollment for anyone who's interested. You don't have to be a patient, so that's for anybody who's interested in that. And then we have 3 providers who are working with us. So they provide primary care services. We see all ages. And we also have podiatry services once a month there now. So depending on the community needs, that's where we're bringing in more specialties into Tres Puentes. I'm going to give you this as well. I just brought extra flyers. So I saw that you guys have a table outside. And then the last one is the map.
Mm-hmm.
So this map shows you our Bronx clinical sites, our behavioral health site, all the schools in Urban Health Plan, all the schools that are under Urban Health Plan that have a clinic inside the high school or middle school. You'll see them there. I believe we have 12, right, Jeanette? We have 12 school-based schools. We have 12 12 health centers in the Bronx, one in Queens, and one in Harlem. So the information is there, and everybody is welcome to visit any of our sites, come in for a tour. One of the coolest things that we've done at Tres Puentes recently, and Christine was able to see it, was a library that we built in our waiting room area for our pediatric patients. It's a corner just dedicated to them, promoting literacy for the kids, but also, kids are afraid to come to the doctor. So this is a welcoming space for them where they can grab a book, read, take it home, read in the waiting room area with their brothers, sisters, their friends, or their mom. So one of the things that we're also doing is partnering up with Mott Haven Library, where they have come and tabled at our waiting room area, and they were providing library cards to the patients there. So without further ado, if anybody has any questions, I'm open to answer any, and just wanted to,
I have a quick question. Stephen Palmer's community associate for Bronx Community. One, is there any possible way to mimic what you're doing at Tres Puentes with the library and other urban health sites?
That's the plan. Yeah.
So you're planning on expanding that?
Yes, that's the plan. That's the plan. The program that funded us, they were able to fund us $10,000, was Books from Birth, and they were the one who were able to provide us with that funding, the furniture, the books, all of that, and we were able to.
Yeah.
Such a great space.
Mhm.
Beautiful job.
Thank you.
Yeah, that's awesome.
Hi, Julian. Is there an age limit or age range you have? Just children, adults,
No,
family?
all family, yeah. So from 0 to whatever, yeah. 0 to 100 and plus. Our oldest patient there, she's 101. Yeah.
Do you do anything with substance abuse?
So with substance abuse, we see all patients. With substance abuse, that would be more of a referral, depending on that patient needs. There's a bunch of questions, screenings that are done. That I know that there is I think Samaritan is around the area where we at, and we have sent some of our patients there. They have come over to our clinic as well. So depending on the patient need, there's a couple of questions the provider asks them, and then we'll send them on we refer them to the most appropriate place where they can get. Okay. Okay. Good to know. Good to know. Good to know.
It's great. I love what you guys do.
Okay.
Yeah. Any questions?
How do you guys do your outreach?
So outreach like this, like this. So a couple of things. We used to have someone who did outreach specifically for Tres Puentes. So I've been going out in the community and meeting other organizations. We do have a team, a community engagement team that does outreach in all the clinics. So one of the ways that I got involved was with the Mott Haven community partnerships, and I am able to participate in their meetings, and that's how I was able to get to know all the other organizations that are in the Bronx. Meetings like this. I also had the pleasure of meeting Clarissa as well, and joining one.
Sorry to cut you off. The chair asked that make a statement. I want to just add that she's a patient of the Tres Puentes, and it's amazing, clean, quick. They don't rush you out, so the doctors take their time, and they're very thorough.
Yeah.
She asked me to drop that.
Awesome. Oh, no, it's okay. Yeah. Yeah. So meetings like this, the Mott Haven Community Partnership, doing tabling outside. There are other organizations who walk into Tres Puentes, and I like to get to know them a little better. Like Mott Haven Community Library had walked in there and wanted to do tabling. Boricua College is also providing tabling services, so they're giving patients higher education information to our patients in the waiting room area. And then this summer, when it starts getting nicer, weather's nice, I would like to do more tabling outside. But yeah. Yes, amazing. Thank you.
Thank you.
So I have some questions.
Yeah.
Chair.
Mhm.
So, given the fact that this is extremely important because we are trying to be able to open up or support as many qualified health centers. It's all important about how people feel when they go to the doctor. You go in, you feel rushed, you feel like you're on a conveyor belt and you're in and out. That's one takeaway. These urgent care facilities are unfortunately, the doctors are not doctors that are permanent. It's you go and you see a new doctor every time. And then we want to encourage more Black and brown people to go to the doctor. condition.
Right.
There's a lot of people who don't have a primary care physician, so you don't know what's going on in your body until it's too late, or until you go to emergency room and you're finding out that emergency rooms are unfortunately treating you a certain kind of way because they're like this so many stuff, so much going on in your body already that basically they don't take that actually emphasis to want to work on life-saving things. So going to an internal medicine person is prevention.
Right, prevention.
How are you? And I'm looking at all the services you're providing. We look at all the issues that are primarily affecting our community. Poor diets, so nutrition, and that information, which leads to diabetes, which leads to heart disease, which leads to cholesterol, that leads to so many social health conditions that has impacted our community and led us to be still for decades number 62 unhealthy areas in the Bronx. So how is your facility being fairly new? I thought really when I first the chairboard is my attention, there was a doctor for geriatric care. They're a senior
I
center,
know,
right?
because of the facility above us.
Facility above, so
Yeah,
maybe
I know we
they
get
think
that a
so.
lot.
It's like a secret that's getting out there now. Now it's going to be very crowded now. So they're like, hey, everybody can go inside here. So you have that impact it's going to make. How are you working to do preventive care? Instead of just seeing people just for internal, regular medical situations. Because part of outreach is also education.
Education.
So how is site specifically different from some of the other sites?
So at not only just Fuentes, but at Urban Health Plan entirely, right? The way we work is the patient would come in, right? They'll register, they have a physical exam to get done. The medical assistant will prep them, and then there's a series of questions that are asked, right? But now there's something that we're doing that before we get there, the case manager will ask them some questions just to make sure that if there's any additional resources the patient needs, we provide it to them, whether it's food, housing, nutrition, whatever it is, we provide that to the patient. Once the patient is in the exam room with the provider and the medical assistant does extensive questions about their health, about their family history. There's a lot that goes on in the room. And then the provider goes in there and asks a whole bunch of other history questions, depending on the patient's need, right? Because if it's someone healthy, if they're really healthy, but if someone who is diabetic, asthmatic, suffers from other conditions that the provider lists down, they start generating referrals, right? So if this patient needs nutrition, right? If this patient needs an endocrinologist, if this patient needs to see an optometrist because they're diabetic, if this patient needs to see a podiatrist because they need their foot care because they're diabetic, their sugar is way high, everybody gets involved. The medical assistant, the nurse, let's monitor this patient. What else does this patient need and what is it that they're missing? So we connect them to these resources, whether it's nutrition, even crisis, even a social worker getting them on the phone right there, which happened today. We are able to connect them on the spot and provide that service to the patient. And I think we do really well with that because we work really well with other departments to provide those patients those services. But depending on the patient's need, a referral is generated and we provide them that service there.
And it doesn't and Level Someone also has a cooking demo kitchen.
Yes,
right?
there
It
also
actually teaches classes.
Yes, there also is a cooking demo class for them, and they also do a lot of waiting room. It does happen at the main site where the nutritionist does. They bring out a table and they provide education on patients how to cook healthy, and now with the arts for everybody. That's another also additional thing that they're doing also at Urban Health. Yeah.
And this is another note we're working with Paloma, who I knew for 1,000 years. So, I'm not that old, but she's as young as I am. That we are working with Urban Health Plan and the board, the chair, working to sponsor a health fair because so we're going to be working very closely because we believe
the one in July.
Fiesta San Juan.
And there's another. No, we're going to do our own show.
Okay.
We'll probably definitely join you, but we want to talk about. We want to focus on health issues and being primary because we give out here every Saturday fresh fruits and produce.
Yeah.
Because we want to make sure that folks have opportunity to engage in a healthy diet. We know that it is unfortunately it costs so much to have that ability to have fresh fruits and vegetables. Work with our partners at Bronx Works under the chair's team to bring SNAP as an ability, but we know that SNAP assistance has not been increased by the federal government for decades. But we know that the cost of healthier food has increased, especially post-COVID in our markets. So it's help, and then to have quality food that's in our markets is also scarce too. Bodegas, all of them may have an apple, but the apple may be 2 weeks old or whatever.
Right,
So we
right,
say all of that only because we lean on our federal qualified health care agencies
right.
to make sure that they're doing much more for our young people and for our,
And for the
our aging population to ensure that they have access. We're a big component of that to ensure that access is available. Because when you have access, you don't have excuses. You have opportunities to be able to have those check-ins, especially for Black men who don't go and look at prostate and don't go look at breast cancer and all those things that impact. So education steps in to become that main important part to understand that these are the things we need to be concerned about too. For a long time, remember, we used to worry about asthma. Now we have to worry about everything
else.
in this community, especially mental health. So those are the things that are important to the district manager and to each our community chairs, to board chairs. So we appreciate that piece. What are some specialties that are not yet to come that are on this list here?
At Tres Puentes, so right now we only have podiatry services.
Right.
So depending on the need, so if we see that cardiology is what, because high blood pressure is also another one that we see common at Tres Puentes. So if we see that frequently, and depending on the need of the community, and depending on how many referrals are being generated, where we're like, oh, we're getting thousands of cardiology referrals for our patients, then okay, let's bring in cardiology. Once a week, whatever, every 2 weeks at Tres Puentes. So it really depends on the need of and because we just reopened 2 years ago, we're still trying to figure out what exactly makes sense for the community. But that's we're and actually have a meeting this week, which is about that, bringing the other another specialty service right at Tres Puentes. So, but at Urban Health Plan at the main site in Nuevo San Juan on Southern Boulevard, they do have all the other specialty services. So if we have a patient who needs to get connected to an endocrinologist, like I said, dental, optometry, what else? An allergist, cardiologist. We have a cardiologist right across the bridge in Harlem, which is one of our other sites. We connect them to there, and we make appointments for them over there as well, and provide transportation if they are a certain age. That's if they are a certain age and have some medical conditions. Their health insurance will pay for their transportation to make it to their appointments. Yeah.
Thank my last question. Thank you, Chair, for giving it this holistic health. Everyone doesn't want to, unfortunately, pop a pill, or some people's like, I can't smoke. I don't know. But we don't want to pop a pill every time. And some people don't want to become medicated or medication dependent upon things. So I talk about prevention, reversing things around. How are you looking at holistic living or holistic medicine to be able to help not chronic disease? Because medicine is important, because you don't want to say, oh, I was taking this juice to stop my heart disease, but it's literally you need medication. We understand that. But how are you using holistic methods to be able to look at
I
that?
can speak on that. So it's interesting.
Stand up, please introduce yourself.
It's interesting you should mention it. Yesterday we had a kickoff. There were a group. So Paloma's very high on performance improvement, right? How do you get, what's the issue and how do we resolve it? And so yesterday we had a group of 50 people and a team of 6 people that needed to come together to conduct the project improvement for the next 12 months in order to get our patients, where they need six teams, project improvement. What are the issues? Teams were created. A lot of it was holistic measures. What are we going to do, right? Because not everybody wants to take medication, needs to take medication. And so these 6 teams came together. We have a plan for the next 12 months, which we have to execute. Arts is one of them. So one of the things that during an initial intake, there are screening questions, psychosocial, needs assessment, educational. What does the patient need? Based on those questions, they get referred. Maybe they get a prescription for art therapy, so that they're not taking medication for anxiety. And so we do have SNAP navigators at our sites, which started about 4 weeks ago, which is interesting. We should mention that because food disparity is one of the biggest issues we have. Sure. Can't worry about my blood pressure if I don't have a meal, have a job. And so we do have food pantries as well. We're provide you information for that. There are 2 days out of the week in Hunts Point where we have tons of people that come for food. It started pre-COVID, and then COVID hit, and it just became massive. And now we also have at the main site food pantry as well. So we link up at every site that we have. We link up with the community so that our patients are able to get, nutrition. Because you're right, there is bodegas with terrible food. And the cheaper the food, the more affordable, that's what they're going to do.
Sure.
And so
Poison is almost free,
Oh, exactly.
unfortunately.
Sugar and processed. That's what they sell. So it is a challenge, but we do have 2 days out of the week at the main site. At Hunts Point, they're literally leaving with big boxes of fresh fruits and vegetables.
That's good to know.
Yeah.
And again, we're excited about the partnership. Congratulations to your CEO of being recognized by the Durham Bronx Borough President for Bronx Week, what is now Bronx Month, and getting her name up in lights very soon, hopefully. And so we understand that her father's dedication started this organization, and we want to make sure that we in the Bronx, in our district, continue to now still a little bit away from Community Board 2 over at West Point to come down here to definitely share that legacy of providing quality health care to the folks in Mount Haven, Port Morris, and Melrose. We appreciate it. Thank you, Madam Chair.
Thank you.
Thank you, man. Thank you so much.
Any other questions?
Any other questions? No? Okay. Old businesses? No? Okay.
So we know that we just wanted to talk about that we are looking at more issues at Midpoint for action items for this committee. So like I mentioned, the chair talked about a health fair that this committee is going to be the lead agency on, and this chair, and we're going to be able to provide more candidates for our committee vice chair very soon. So you should look out for that. We have one more meeting coming up in the month of June, which is going to be a very packed meeting regarding some very important information. So we actually please get the package for June to pay very close attention because it's going to be impacting likely the voting items that is support. So we ask you to pay attention to that when it comes through. I have nothing else to add, Madam Chair, for that. That's it. That's all I have right now.
All right, so we're good.
Any motion to?
Any motion to
When you mentioned issues, can we speak about housing?
Yeah, we could talk.
Because I've been with Housing Connect, I legit been applying since 2015, and I have yet to be called. I've been noticing as well that every time it reaches my number, it tells me that they chose somebody else.
Right.
So I'm concerned on why is it that they're taking so many people if at the time when they reach my number, let's say my number is like 2 million, they're not going to choose me because they have to choose somebody
Someone else.
And I'm really concerned about that.
I'm concerned about that too. We can definitely speak about that. I also know that there is some type of glitch in that system as well, from what I was told. I don't know how accurate that is. So if we can speak to or connect with someone.
So my understanding, Chair, is that of course we are experiencing a housing shortage and citywide. But I'm going to speak to your issue specific, or to the issue broadly as possible. And we know that there is a lot of housing that we're receiving. Our team is receiving luxury rent like housing is being built in our district. For example, a studio costing $3,000.
$4,000.
So and that is the city's emphasis is trying to make sure that we have housing for a broad class of folks. We understand under the new legislation that was passed, the percentage was lowered for how many units are set aside for residents living in our community board. We understand that Housing Connect has never been a system that's perfectly worked over a period of time, and it's something that we're constantly concerned about. We're talking to the HPD, Ted Weinstein, the director of development, was just recently here. I understand. So my understanding of how the project goes, you may have an apartment building that has, let's give an example, 440 units.
Yep.
You're going to receive 4,000 applications.
Right.
Many of those applications are people who are not eligible, but they apply anyway. And so that slows up the whole lottery system.
Process.
The process for the
That's
interview.
what comes with our where there should be a cap. Because there's
But
no
then there's also a
reason.
lottery too. So they
How
have
is
to
it
be
a
based.
lottery and then they're choosing somebody other than me? That's
Right.
where I'm confused at.
So the lottery is supposed to, because it's a blind system about how
Right.
folks are chosen.
They pick.
It literally goes into a black bag. They put out the envelopes in the black bag. And whether you sent your application yesterday or you sent it 3 months ago, your application could be chose in any given time. There's no timetable. So it goes all into the black bag. This is an example. I'm not saying how actually happens.
No.
And it all gets picked out in one day. Unfortunately, like I said, with the 400 apartments and the 4,000 that are application received, we know that a lot of people are not eligible, but they're allowed to apply. The system doesn't bump them because they put in the wrong income. It takes them into the system anyway. It's a definitely imperfect system, but they have to go through this process of going through all those people and finding the people who applied with an income and are eligible to apply for this unit. Also, in addition to that, they have to, like you said, like I mentioned, the 20, I think it's now 20 to 25% that's set aside for community ward residents. But then also you have a very large homeless population.
Yeah, so the
Homeless shelters.
DHS is also a priority as well.
The priority.
Yeah.
So it's definitely not a perfect system. I'm telling you this because not to give excuses to the city. It's important for them to do it. I understand personally about how you guys as a person have been frustrated about this system.
It's been like 10 years that I've been applying, and I have yet.
And I've heard that.
I've yet. Right. And so what I will say at the board chair's request, we will call an HPD and ask them to explain it. But I'm giving you that they're gonna try to explain it as plain as I just did. Unfortunately, but we can talk about accountability about what are the percentage of people who with actual addresses who are community board residents who have been likely income eligible for those units.
But also educating the community, because there's a lot of people that are frustrated, just like me and you, who just don't understand the logistics of how they are able
No, I just
to
feel like
call.
also it's a scam. I don't even feel like it's something that's so hard for us to understand. Like, it's something going on in there that is that because it's just too much. It doesn't make sense to me half the time.
Yeah.
Especially when they have people reaching out to me, telling me to send them all the documents. They're not reaching out. And then it gets frustrating because now I'm sending important documents. I'm sending them to emails, and then you're not reaching out to me. Then 7 months later, you updating my account, saying that my the one that I had was taken or whatever.
And
so now where my information is going.
We need to discuss with them too, because
That's really
aside
important.
from
You know what I'm saying? Now my
That's
information
pivotal.
is just staying in somebody's email with my social, with my W-2, and all that because you're looking me up, but then at the same time, I'm not bothered. Like it's
And you're not hearing
adding
back.
up.
Yeah.
Because it's like, why you ask me for information if my loud number is still not even going to be taken?
Yeah, I agree. I do have clients that have expressed their frustration and concerns in regards to that. So there's people that I've assisted that have been waiting on the waiting list for years, for 7+ years. And then they get letters saying, hey, the system is being revamped or whatever it is. And I'm not saying based on Housing Connect, but also for nature. So it's like we need to be able to meet with them, and hopefully in the future everybody will be on the same page to try to see what's their plan and initiative, what they can do to change.
And how can they build in a priority system for those who have been applying for 10
For
years?
10 years,
And
yeah.
there must be a way to document how many times one is applied. So,
That's true too.
Right, because I have cousins that have already applied for apartments, and then they'll just send out a new one and get calls for that one. I'm like, I'm confused. Like, you just got a nice luxury apartment and you apply and you getting the next one? Like, I'm really...
Yeah, that makes sense.
So thank you, Chair. I'll take it back, and then we'll see if we can hopefully get someone from HPD to appear at June full board meeting, because we know that we have our full board meeting this month is scheduled for our city sheriff to show up.
Yeah.
After that, we also likely are looking to have the representatives, senior executive staff from nature show up at our June meeting. So maybe we'll make it a housing chat.
Yeah.
In June.
Yeah, June. All right.
Anything else?
Any
Questions? So she
motion? Oh, you have a
I just
question?
wanted to know about the July health fair that you're having, that we're going to be a huge part of. If you can just elaborate a little bit more on that.
So it's still in the works, because the
Okay.
thing about that is that we want to ensure that we have a lot of other, that the community it's one that they know, and that we have a lot of other collaboration with other organizations to inform the community what health, the health fair is going to be about. So we want to be able to have that set, and then we'll send you guys an email.
Well, we know that Urban Health Plan is working on a health fair
In July, yeah.
You want to talk more about it briefly? Or?
Yeah, it's so it's called Fiesta San Juan, and we haven't done one for over pre-COVID, right? So it's been 4 years that we haven't done one, so it's going to be very special, very big, and it's over by Enroa San Juan Southern Boulevard, where one of the streets is closed down, and all of our departments and sites come together, and we do tabling session, provide education to the community. There's also going to be a stage where there's going to be entertainment, music, raffles, a lot of things going on, a lot of fun things going on that day. So it will be sometime in July. I believe it's the last Saturday of July. Yeah. You'll see it on Urban Health Plan's social media.
Okay.
Yeah.
All right.
That's on
July 27th.
It's on the 27th. Okay.
And it's our 50th anniversary this year. So
Right.
It's the biggest one
Yeah.
we've ever
So that was going to be an anniversary.
Oh, that'd be awesome. Okay. All right. Cool. Motion to motion. Okay.
A second.
Second. Okay. Well, all in favor? Aye. Meeting adjourned. Thank you. Woo, child. That was amazing. I know. I was happy. I know, right? Little by little. I wanna. I don't have.